Hi everybody, my name is Uwe and I'm the CEO of a company called iHealth Labs Europe. So iHealth is a worldwide leader of connected health solutions. By connected health is that we actually develop devices that take the signals of the body and translate them into a meaningful format using a tactile platform. So we do blood pressure, weight, diabetes, exercise, sport, and it's all linked to a single application that allows you to see the relationship between one disease and another disease.
How do you assess the latest development on the field of connected care?
Well, that's quite an interesting question. It's a trick question. I'm never going to tell you that my machines are better than another machine. That's not true. Taking a measurement is easy. It's knowing what to do with the measurement. But there's four differences that differentiate iHealth between other manufacturers. One is, of all the manufacturers today of medical devices, I'm the only one who actually is a manufacturer with our factories, our very own private factories where we have 2,300 people, 400 engineers. But the second difference really relates to your question, is that I come from 20 years of clinical, culture, medical validations, R&D, and the problem is that it's today become too easy to make a new product. Any moron with a good idea goes and puts it on Kickstarter and Indiegogo, and they launch products without having that medical background. And so I'm doing a lot of work now working with companies to show them, having an idea is easy. It's knowing what to do with the idea. And I'm working with these startups that don't really know, they think that just having the idea is going to be the beginning and the end. But having an idea, you need to know how you're going to set it, who's going to buy it, who's going to distribute it, how you're going to work with the customer. So, as an example, iHealth does not make blood pressure monitors, iHealth does not make glucometers, we do not make scales. I always say iHealth makes tools for the heart. Mm-hmm. And if you can touch the hearts of people, the possibilities are just about infinite.
Okay. You were speaking about gadgetization of e-health, connected care.
Absolutely. What I mean by gadgetization is that it's become maybe too easy to make a new product. The barriers are getting lower and lower, which means that every second day we have a new magic product that comes out that does click, clack, boom in the morning. And this is gadgetizing the industry in the eyes of the doctor. Basically, medical people don't really think of connected health, they think of connected gadgets. So we need to work assiduously to actually make this into a medical device rather than just into a medical gadget.
Okay. And what's the other challenge for connected care?
The biggest challenge is really acceptability in terms of data safety. There's a lot of legends that are going out there that patients think we're going to steal their data and sell their data. People have not yet realized that the only data that is useful for me is when it is anonymous. Because when it's anonymous, I can use it for medical research, epidemiological research. Mm-hmm. As soon as I know that it's your data, I can no longer use it.
There's no privacy issue involved.
Well, today I'm probably one of the only manufacturers who really is a secure data provider. But I think that everybody realizes that we will be defined as the generation that has basically given up our right to privacy. We like to complain about privacy, but then we go and share all of this information on Facebook, on Twitter, and on other social media.
Okay, so that's no issue anymore after our...
Well,
but this generation and the next generation is going to live very long. You told us the person who will be 150 years old is already born.
That is correct.
Yeah.
Today, basically, if you're born in 2014, you have a 1.66% chance of being 130 years old. You have a 33% chance of being 100 years old. Statistically, the 150-year-old man is already born. Today, there's 450,000 centenarians on the planet. People who are over 100 years old. That sounds huge, 450,000. But in 2030, will be 30 million centenarians. And today, people don't want to live to be 100. They want to live to be 100, capital L, underlined. They really want people, they want to be have a full life until the day that they die. So the service industry, taking care of these people, taking care of their health and their chronic diseases, is going to become a huge part of the healthcare systems of tomorrow.
And can we afford that, to be with many more people who become much older?
Well, absolutely not. I think the healthcare systems are going to change in terms of responsibility. Right now, we've always said, especially in Europe, where we have socialist healthcare, that healthcare is not my responsibility. Healthcare is the government that pays. Because basically, for instance, I live in Paris, where it's amazing to be sick. You stop work, you get paid, and Social Security pays for everything. So what is the interest of doing prevention? But in the next few years, you're going to see a shift of responsibility where the governments, the social healthcare systems are going to tell you, it's not my job to take care of you if you're fat. It's your responsibility. Very much like what they're doing in Norway and Finland. In the UK, for instance, they have a new system where the doctor is paid not to see his patient. He gets a budget for, let's say, his 200 patients, and he says, whatever you spend on those patients, whatever you don't spend on those patients, you can keep. So he has the responsibility of offering preventative health for his patients. The less he sees his patients, the more money he will make. So in the future, we will actually make sure that in fact it's you who is responsible for your health. And if you're fat, or if you, 91% for instance of people who have diabetes have acquired diabetes because of bad eating habits. And why should the government pay for this? You should be the one who should be held responsible for it.
Okay. How are you going to challenge the participants on the iHealth convention on the 4th of October in Amsterdam?
Well, for me, the greatest pleasure is really going to be about looking at the future of health and how, in reality, their ideas can translate into a real subject. The problem is today that a lot of people are using the promise of the future for not doing what they should be doing today. And really what we have to do is not just have an idea, but see how we can develop that idea. And that's what I'm really looking forward to do at the Congress.
Thank you very much, Uwe Diegel.
It's my absolute pleasure.